The latest information provided by the Pan American Health Organization PAHO suggests that the challenges of mental health in Guyana consume more resources than HIV/AIDS, malaria, and tuberculosis combined. That's an idea of the extent of the problem. While mental health issues have been dealt with from a reactionary standpoint over the years, Chief Medical Officer Dr. Shamdeo Persad says a more holistic approach is being developed to tackle mental health, which has become an unpalatable pill to swallow.
Previously, the ministry never had the post of social workers, so we've since incorporated, and psychologists. Now we have several persons employed into those capacities at the central unit. We're trying to work out a system where we could provide to at least the 6 target regions for now, but hopefully in the long term, by 2020, we should be able to, at least that's the goal, to have at least one person with some mental health training, whether it's a nurse, a doctor, a counselor, or so on, at each health facility.
Dr. Persad, who was at that time responding earlier this week to questions by reporters on mental health issues. According to the CMO, more focus is also being placed on community capacity development, which caters for the reintroduction of the Gatekeepers program.
For suicide prevention, where we identify key leaders within the community, whether it's religious leaders, sports organizers, and so on, and we bring them to a training program to help to train them how to identify vulnerable persons who have ideation for suicides and so on, and how they can intervene into those persons, into the progressions, and interrupt that thought process that leads to suicide.
The reintroduction of the Gatekeepers program is expected to be rolled off in the second half of this year, Dr. Persad noted. Touching on the issue of stigmas and discrimination associated with mental health conditions, the CMO says that targeting this problem is high on the agenda for the Public Health Ministry.
So much so that persons who display mental health illnesses are even excluded from their own families. So you see a lot of street persons have mental health issues, and then they fall into drug abuse, and it just becomes a desperate cycle of despair. So we recognize that deficiency, and we hope that the community interventions, could help to start addressing that stigma.
He added that a lot of the stigma associated with mental disorders is rooted in the way how both families and communities react and respond.
So it might take a little while for us to put a program in that could address, but definitely public education, I think, is one of the first steps.
Reporting for HGP Nightly News, I am Kristen Macklingam.